Okay, it's Dr. Buford. We're just getting started on your left knee here. This is the medial compartment. We've already made some platelet-rich plasma, and that went well. Looks good. And now we're checking out the arthritic condition of this compartment. You can see some thinning of the articular cartilage here on the femoral condyle up above. And then there's our meniscus tear. Hold the camera for a minute. And we're going to open up the joint a little bit and see if we can't get a better look at this meniscus tear in the back. There it is right there. And so, like we discovered with our imaging, this tear is at the peripheral edge of the meniscus in a place where it's not really repairable, and yet in a place where it can flip around and cause symptoms. And so that's why we just resected it instead of repairing it. Hold the camera there. Okay, so now we're looking in the central part of the knee, the area that we commonly call the notch. And yours is kind of interesting. Obviously you've had that prior surgery, but you've got a lot of calcification and kind of bony overgrowth of the notch here, probably why your knee's not grossly unstable. Because this is, you can see here's the medial side. We've already taken care of the meniscus there, and then here's the notch. Normally you can run the shaver back up here, or at least see the graft, but you've got kind of calcified notch all the way across. What's left of a graft is kind of down low here. So really nothing to do there. We're going to look in the lateral compartment next. Table down, please. Okay, so this is the lateral compartment now, and you've got some arthritic changes here as well. Not too much to do here. Now here's some loose areas of articular cartilage on the femoral condyle. If there's anything obviously loose, we'll remove it. There's an example of a loose flap there. And very similar findings on the tibial plateau down below. Now as we look back here, this posterior horn of the lateral meniscus looks okay. And like I said in the office, I don't want to take anything away that might still have some benefit, but this flap, as you can see, is something that can certainly cause problems for you and might be responsible for some of the catching and clicking and mechanical symptoms that you were having. Okay, so that looks better to me. At least nothing grossly loose and kind of hanging down there. So I think that's a little bit better. Like we talked about in the office, we may want to do one of our bone marrow concentrate or cellular type procedures in addition to the PRP to try and keep you out of the operating room for a knee replacement down the road if you have symptoms. But that's where we're at right now for that. Okay, that looks much better in my opinion. Show you some more in a little bit. Okay, this is now the patellofemoral joint. You've got a lot of arthritic changes noted here as well. Patella is at the top of the screen. The trochlea is right here. If we track this down, we'll get to that front of the knee. Remember that trochlea had some calcified area. It's right here. I just want to make sure it's not loose. My shaver, just for orientation, my shaver is right in front of the trochlea, and there's still a piece of bone here. Whether that's an old tibial eminence fracture or something that's grown, I just want to make sure it's not blocking your motion. Okay, I think we're done here. I'm just ranging the knee, and we can see here's the intercondylar area. Again, huge osteophyte blocking our vision through the notch. And as we extend, we can see all the way over here. So I think we're going to finish up here and get you back to the recovery room shortly. Your knee is in full extension right there, so I don't think we're blocking your motion with that view right there. That looks pretty good. Good luck to you now. Bye-bye.